The British government is scrambling to ramp up intensive care capacity as the number of coronavirus cases continues to grow. The main hotspot remains London, where hospitals are clearing wards and repurposing existing facilities in readiness.
We are not at capacity yet within London, but beds are being opened all the time to produce that extra surge capacity. So in the first instance, we are using theatres and recovery areas. So those are areas in hospitals where anaesthetic machines, ventilators are already used for surgery and can be readily adapted to take critically ill patients.
The government is also building new field hospitals. This London conference centre is being repurposed to house up to 4,000 coronavirus patients. 2 others are being built, one in Manchester and one in Birmingham, which will act as auxiliary clinics during the peak of the pandemic. The Prime Minister and Health Secretary continue to oversee Britain's COVID-19 response, despite both testing positive for the disease. They chaired high-level video conferences from home isolation. Boris Johnson also posted this message online to update the country on his efforts to boost NHS staff.
And thank you by the way, to everybody who's now coming back into the NHS in such huge numbers. We have, just this evening I can tell you, we have 20,000 NHS staff coming back to the colours, doctors and nurses. It's a most amazing thing. And that's, of course, in addition to the 750,000 members of the public who have volunteered to help us get through this crisis.
Another major focus remains the severe lack of ventilators needed for the country's hospitals. Major companies like Ford and Airbus are now working alongside universities and smaller firms in designing prototypes ready to be fast-tracked for government approval. Trent Murray in London, Euronews.